Good morning, everyone. My name is Bodimeade, and thank you all very much for coming. Thank you in particular for the host for inviting me to speak to you today. It's been really inspiring seeing all the other presenters and all the wonderful data and models that they've been collecting, and been quite inspiring. I feel like a bit of an imposter because I'm not a data scientist or an analyst. I'm a doctor, and I don't have a large amount of data or any fancy models. But this is like a proof of concept study that I did at my hospital, and it's all my own work, and I'm only speaking on my own capacity. But I hope you enjoy what I've got to say. So I'm a surgical trainee, and I'm frustrated. I'm frustrated because I went into medicine because I wanted to be doing this kind of stuff. I wanted to be in theatre, talking to patients, analysing problems, getting practical solutions, and feeling that satisfaction. But in reality, I think at least 75% of my working day, if not more, is spent in front of a computer. First, I've got to find a computer because we don't have desks. And I've got to hope that computer's not used by anyone else. And I've got to hope that it's been booted up and is working and it's charged. I know the passwords to get in. They haven't changed it that week. And once that's done, I load everything up and I start documenting. And most of my job is basically documenting what's been done and what's going to happen, or talking to other specialties. So there's a huge record of what's happened. And frankly, that's not why I wanted to go into medicine. And at the beginning of this year, so this frustration kind of is always going on in the back of my mind. And then I heard about this, which is ChatGPT. And I thought, hello, this could be a little solution. This could help me with some of my documentation. There's room to explore here. And so I thought of a little project. And the project was about discharge letters. So I work in ENT, which is the ear, nose and throat department, and we do a lot of tonsillectomies. It's one of the most common operations we do within the NHS. It's very well rehearsed, the complications are well known, and the patient demographics are quite simple because it's normally children of good health who have the largest number of tonsillectomies. So I thought, could we have ChatGPT draft a couple of my discharge letters that I would otherwise be doing, and then I compare them to my discharge letters, and then could I circulate them amongst the department to see if anyone could tell the difference or rate them according to what's better and what's worse. No patients were involved in this. Everything was anonymized. There was no danger of anything getting out of that closed circuit of our district general hospital. So I went on to ChatGPT on the 5th of March and I asked them, please, can you write a discharge letter for a patient who has had a bilateral tonsillectomy surgery, including aftercare advice. So it's a hypothetical patient, didn't specify anything about age, comorbidities, things like that. And then I took 2 of my own discharge letters that I'd written at the hospital from the year before I'd even heard of ChatGPT. So there's no danger of writing deliberately better ones or worse ones to compare favorably against the program. And then what I did is I circulated amongst the departments. I put the 4 letters into a Google form, and I wrote down the questions that I wanted people to answer, and I circulated in the department, which is 19 people, 7 consultants, 5 registrars, 7 SHOs, and their level of experience varies from maybe months in the job to decades in the job, but they're all familiar with these letters. They've all probably written them, almost certainly they've all written them. And so they know what they're talking about, and they know what they're to look for in these letters. And this is what it looked like. So you have on your right a copy of one of the letters, and there were 4 questions I asked after each of the letters. The first 3 questions were subjective, different parameters where the reader was asked to rate on a scale of 1 to 5 how good the medical information was, how good the ease of reading was, and how good the length of the letter was. And then the final question was, can you guess whether this was written by a human or was it written by the AI chatbot? And so here are the results. And I don't have time to show you all the letters, but let's just call them A, B, C, D. I'm going to show you the results from each one of the questions. Feel free to try and guess which one was the AI and which one's the human as well, just by the other people's responses. But the first question was, please rate the quality of the medical information. So our answers were letter A came out very favorably with an average mark of 4.11 out of 5, followed by C, then B, then D. The next question was, please rate the ease of reading. And these are the answers we got. So the average highest mark was for letter C, and then followed by letter A, and then letter D, and then letter B. And then the final question I asked them was, please rate the length of the letter. So here we had letter B came out top, followed by A, followed by C, and then followed by D. And so I just accumulated all of these scores up, and I gave you an overall score for, just subjectively, what the respondents thought was the best letter on those 3 different parameters. And letter A came first with an average score of 4.07 out of 5, then letter B, then letter 3. Then letter A came first, then letter C, then letter B, then letter D. And so I also did a tiny little bit of analysis where I combined both the scores for both AI letters and combined both the scores for my letters, the human letters, and then compared the average there to see whether anything was significant on the 3 parameters. And it turns out that the AI letters are significantly easier to read than my letters. So now, who do you think wrote this letter? These are the responses I got from my department. So letter A, 47% of it thought it was a human. Actually, with ChatGPT, so 53% of people were correct. Letter B, 68% thought it was a human. Actually, it was me, so 68% were right, I was a human. Letter C, 84% thought it was a human, or was actually ChatGPT. That's 16% of people correctly guessed who wrote that letter. And then finally, you can guess by process of deduction, this is my letter again, it's a human letter, and 84% of people were correct. It was me. So just a quick sensitivity and specificity of how good ENT professionals are determining whether a letter is written by one of their staff members or by a computer. It turns out they're pretty rubbish. So their sensitivity is 34%, just about a third of them can tell. And then they're better at detecting the human written letters. So in conclusion, AI discharge letters were superior in medical information, ease of reading compared to the letters I wrote. Cumulative scores were higher for both the AI discharge letters compared to the human letters, and professionals were unable to distinguish between letters written by AI and those written by humans. And so just a few things that I thought when these results came out. So firstly, this little game I suppose I played is only really useful when you have a highly stereotyped procedure like tonsillectomy. It's not going to work with complex medical patients on medical wards, lots of comorbidities, lots of different interventions are being made, lots of different medications playing a part. That nuance and subjectivity probably is beyond the realms of an AI letter to write. It needs a clinician who's experienced with them. But however, there's plenty of elective procedures that are amenable to this kind of process, to have letters written like this, and to save junior doctors on the ward people time to allow more time with patients, or to do other stuff in a time-stressed situation. So I also thought, why were the AI letters easier to read? I mean, partly because probably my letters aren't very good in general, but that's, I think it could be written, I think if you compare it to lots of people's letters, when you're writing a discharge letter, you're not just writing your own discharge letters, you're writing for other people, because all of the paperwork well downstream. You're under time pressures, you're being constantly disrupted, you don't have a computer. So you cut corners, you write as little as possible, as briefly as possible, and that leads to poor outcomes for the patients, for the GPs, and the communication is pretty poor. We can have an AI program that writes better letters, then why don't we embrace it? Because it's going to be quicker and better, according to what I showed today. And then just even when I was doing this in my department, and as I said, no patients were involved and no harm came to anyone, but there was a slight amount of people being a bit suspicious of this, and what are the implications of letting AI write our letters, and what danger could this cause to the patients? But as I hope to try and open up the debate, it's like patients are probably already coming into harm because we have to do all this documentation because of the poor quality. But if we have an opportunity to do stuff like this, it may actually have the converse effect of helping. That's all. So further work Obviously, large sample sizes. We're working with other departments now. I've got 34 respondents to the same program. Discharge letters aren't read by ENT professionals, they're read by GPs and patients. So we really need to get their perspectives of what they think of these letters. We need to do more procedures, different apart from tonsillectomies, and then we need to use different AI programs. So ChatGPT is one, but there's others out there now. And that's everything. So happy to take any questions now, happy to respond to any on email, and happy to collaborate if anyone wants to.
Just to check, use AI. Why use AI when you just have a template that is repeatable?
Exactly. And every single hospital I've worked at could do that and doesn't do that. And why is that the case? So I have no idea, but it's less exciting to say let's do a template, and this is like an element of bandwagonism that could be, gets people's attention. And also I think templates, when you go to a new hospital, all the systems and processes are generally different. So you have to know where the template is, you have to have familiar with the electronic patient records, and someone has to tell you how to use it. This is accessible, and anyone without a baseline knowledge can go, can you write a discharge letter for this patient's tonsillectomy? And it will be of this standard, which is pretty good. Yes.
Have you thought of what info you need to give to the prompt to get the right information in?
Not really. I mean, I was giving the prompt to the AI as the prompt that I get from my bosses, which is please write a discharge letter for this patient had tonsillectomy.
Because I suppose the next step is to check for correctness of the information that you're trying to convey.
I think that's the fact that the ENT department are more satisfied with the information that the chatbot writes than one that I write.
If the next speakers just come down and start to get ready, you've just got 2 minutes for a quick change.
I can get outside.
Oh, you think I'm outside? Okay. All right.
Any other questions?
Yeah, taking the question.
I was just going to ask, you say argument say you started it in work, what kind of order you was high, and then right, what kind of quality of that
So it's incremental, it's not going to be a panacea at all, but it's completely, I mean, time is so precious with the job that you're doing. And if you can save, if you do 4 tonsillectomies in the morning, that's maybe 10-15 minutes each discharge letter and documentation that comes onto it. There's an hour every operating list that can be done, and that's an opportunity to be doing something more productive. So it would add up quite quickly.